Welcome back. You're watching The Fix with me, Karima Brown. I'm in conversation with Trade and Industry Minister Ebrahim Patel. Minister, you were speaking to us about the consultation processes regarding the list, let's say, of winter clothes when we went to lockdown 4. And I get that you have consulted in those forums. But in today's Sunday Times and leading up to this interview, you have come under criticism by some of the scientists, including someone like Dr. Glenda Gray, who sits on the advisory committee that advises the health minister and the cabinet on COVID-19. And they essentially saying that lockdown 4's rules made no sense, that they were not consulted, and in terms of the science, it doesn't add up. And as far as they are concerned, we should actually just go straight down to level 1. How do you respond to this, Minister?
Can I also connect that to your earlier comment just before we took the break, Karima, where you said, is it appropriate for government to get into this level of detail?
Yeah.
And frankly, I think that we need to move as quickly as possible to a system that is based on individuals being able to exercise the rights, the discretion that all of us value as South Africans. And in that early period, the less we knew, the more intrusive the regulations were. The more we needed to limit movement of people, the more we get to know about the virus, how it spreads, and the more we build up our toolkit. And let me just make that point. We've used the 52 days to date really to build up a toolkit of slowing down the virus through the lockdown, and now increasingly building up the stocks of hospital supplies, on the area of ventilators and masks and so on, as well as equipping hospitals and introducing protocols at the workplace, social distancing 1.5 meters away from each other, hand sanitizing, cleaning up the areas. So we're getting all of society really more able to operate appropriately, nimbly, flexibly in an environment in which we have high risk still of infection. And so government needs to be able to do these things at an early point, but as quickly as possible. As the systems are built, we need to enable more South Africans to be able to drive these things. On the question of scientists, I mean, you put a group of scientists in a room, they can contribute enormously to our understanding, and we want this thing to be science-led, facts-led, and based on the evidence before us. And I have no doubt that different scientists will emphasize different areas. The key thing that we're learning from the scientists, and we're enormously grateful for the information that's coming through, is that we've been able to flatten the curve. It doesn't mean that there's no infection. In fact, the infection will still rise. And that is the thing that we need to manage.
Yeah.
But it means it's been pushed out. Instead of being a sudden spike that overwhelms the healthcare system, it is a more manageable one, we hope. And of course, over the next few months, we're going to be able to see whether we flattened it enough. And these are the challenges that we have to face.
Minister, let me come in here. Let me come in here. We are imminently, as you said earlier on, going to level 3. Negotiations are ongoing in NEDLAC. We're expecting an announcement from the president very shortly. The World Health Organization, who declared COVID-19 a global pandemic, have 6 criteria for lifting the lockdown. They say that transmissions must be controlled, health systems capacities are in place to detect, test, isolate and treat every case and every contact. Outbreak risks are minimized in special settings like health facilities. Preventative measures are in place in workplaces, schools and other places where it's essential to go. Important risks can be managed. Communities are fully educated, engaged, empowered to adjust to the new norm. Now, this is the World Health Organization. We have someone like Dr. Helen Rees, who is a South African who serves on that eminent body that gives these guidelines. To what extent is your decisions as government based on the World Health Organization? And given that even among scientists and epidemiologists, there seems to be different scientific explanations. I mean, we've got a group of really eminent scientists here saying the lockdown as a phased approach, opening up the economy, is of absolutely no use. You are caught between a rock and a hard place. Who is going to inform your next move?
So the World Health Organization to us would be the gold standard of advice that we can get. It brings together both eminent scientists from across the world, but they're also looking at the experience of countries. Some countries that did a lockdown reopening, where they lifted the lockdown too suddenly, saw a spike in infections, and they had to introduce greater controls. In fact, German Chancellor Angela Merkel has spoken quite widely about the risks inherent in too quick a reopening. On the other hand, we've got to enable economic activities. So it's playing that fine balancing that is critical to us, ensuring that we are able to hear what the World Health Organization says, what eminent South African scientists are able to say, and then use that information as key drivers of the thinking in government on how to structure the risk-based approach. Of course, all of them ultimately says it is the decision of policymakers on how you manage that risk. Scientists can tell us the level of risk. They can tell us the kind of things to reduce the risk. Governments then across the world put in place the policy systems. Very interestingly, we did a 5-level lockdown arrangement, with level 5 being the most restrictive and level 1 being the least restrictive. Some period after we did that, the UK introduced a 5-level alert system also. More countries are moving to this because they recognize that using scientific knowledge that assesses the level of danger and then enabling us to put in place the systems in the economy, in society, covering religious activities, sport activities, social activities, and so on, to help society to organize in a manner that reduces that risk. Here's the challenge. In 1918, we had a global flu epidemic. It became known as the Spanish flu. And society was not prepared for it. No deep knowledge was there. And that has haunted us because about a third of the world caught the Spanish flu. And the estimates of people who died go as high as 50 million. Our world is much more integrated. We are in a globalized environment where transmission is extremely rapid. But we also have technology and science as important allies, because scientific knowledge can drive how we deal with these issues.
Having said that, Minister, let's take the Western Cape. It is, together with the Eastern Cape now, having the highest rate of infections as well as the highest rate of deaths. The Western Cape is also governed by the Democratic Alliance. They are going to court to challenge the lockdown rules, despite the fact that there's imminent discussions and decisions, rather, on moving to level 3. If we take the district approach that the Health Minister has said is the rationale in terms of controlling the infections. What are you going to do about the Western Cape, and what are you going to do specifically about sectors of the economy that is concentrated in the Western Cape if you are to follow, one, the district approach, and the fact that the Western Cape is, in many cases, the epicenter, and of course that you have a government that is essentially of the opposition that don't necessarily see managing this disease the way you do at national level?
I would like to emphasize that the first thing we've been at pains to do, and that we should continue to do, is to depoliticize the fight against COVID-19. This is a national crisis. There are human lives. More than 250 people have already died locally. And so we've got to put everything together. All our historical differences must be put aside. And as South Africans, we must work hard to contain the crisis, to limit the spread of the infection, and to do everything possible to allow those who become infected to get the best treatment possible. So really, I think this is about depoliticizing it, and a little bit less grandstanding and a lot more working together will save lives. And that's what we have to do as South Africans. As regards the different provinces, we in fact have a structure called the PCC, that's the Presidential Coordinating Council, and that council brings together the premiers of all the provinces and the local government representatives. It's chaired by the president. You referred, Karima, to the fact that we consulted with NEDLAC on Friday, but on Saturday, yesterday, we had an extensive session, a many-hour-long session with all the provinces and with municipalities, and we heard them on their concerns and their advice on the lifting of the lockdown. Of course, when the structures of government sit down, we'll be taking into account the feedback from all the provinces. The Eastern Cape and Western Cape were both there. They spoke and set out their issues. All the other provinces were there. And then we will, finessing all of that into an announcement that will be made. Of course, I'm not going to make that announcement today. The president will make an announcement. But we've taken all of that into account.
But if you, Minister, if you are just looking at the numbers, the Western Cape, both in terms of the World Health Organization criteria and your own district criteria, you can't imagine Cape Town opening up. They are not at the levels where you can say the transmission is controlled.
We are very concerned about Cape Town. Cape Town has become an enormous outlier with a significantly higher number of people infected for every 100,000 people in Cape Town. We've done comparative analysis showing the rate between different districts and between different provinces. And without any question, Cape Town is a worry. It's my hometown. It's where many, many South Africans live. It's about us as government doing everything in our power to save lives in Cape Town and across the country. And so once the president has outlined the approach in the new levels, we will be doubling up efforts to work closely with all the authorities, local authorities, provincial authorities, and national departments to see what we can do beyond what has been done so far to improve the containment of the virus in Cape Town. It is a great worry, but also in the Eastern Cape, and there's some evidence of a flow of transmission from the Western Cape to the Eastern Cape. So we need to see how we can coordinate to a greater extent between those two provinces to limit the transmission of infection. But for the rest of the country also, we must not be complacent because this virus can flare up anywhere in the country. It could be in Johannesburg next. It can be in eThekwini next.
Minister, I hear you. We're running out of time. I need to just get a question in around the fact that the Competition Tribunal confirmed yesterday 11 million for inflating prices. It says the Competition Commission welcomes the decision of the tribunal to confirm as an order the 11 million consent agreement with a distributor of face mask and personal protection gear. That was a while ago, but you have also fined some individuals and companies. As the demand for masks continue, as public transport, which is notoriously difficult to manage, both in terms of social distance and people just practicing the proper steps, you have come down hard on companies. Just give us the latest on which companies have been fingered and what are the fines that they have been slapped with.
So, Karima, the problem to just share with viewers is that when the state of disaster was declared, we saw very regrettably that a number of businesses and entrepreneurs put up their prices on scarce goods. Hand sanitizers that were going for a reasonable sum suddenly doubled or tripled in price. A face mask that was selling at perhaps 15 Rand immediately was hiked up to 90 Rand or 100 Rand. Now that was exploiting a situation to the detriment of all of our people, every South African. And government acted immediately. We've got two laws, the Competition Act and the Consumer Act. We put those regulators to work. The Competition Commission has done a really good work in investigating a large number of complaints. The first dozen or so have already gone through the system, and in many cases, businesses, pharmacies, and others have reached settlement agreements with the Competition Commission, in which they acknowledged a guilt, and they were slapped with heavy fines. And in other cases, they also had to make a contribution to the Solidarity Fund so that we can use that money, in fact, to buy masks and sanitizers and so on. So it shows we are quite determined to act firmly against people who charge excessive prices and unfair prices in this period, because we've got to be in this together, really working together as a society to get back to normality. In a normal market, supply and demand is managed through the normal competition mechanisms. In a constrained environment as we are now, where there's shortages, no one should be able to hoard these shortages and score from it, because in the end it will mean lost lives. If we run out of money to buy masks and to buy hand sanitizers at family level, not just at government level, then people are placing their lives at risks because of a few who want to profit. And that must really be stamped out.
All right, Minister, so we have run out of time, unfortunately. There's obviously so much more we can discuss. Hopefully you will indulge us again and come up, onto the program to speak to us as we open up the economy. Thank you so much to Trade and Industry Minister Ibrahim Patel. Up next, the role of think tanks in the battle for ideas in the era of COVID-19. Don't go anywhere.